Hello, this is Caitlin Fowles for the Carrington Road Report for 2015. New Zealand struggles with a number of health issues, but Kiwis also show major attempts of problem solving and huge innovations in the area of health science. In this report, students from Unitec's news writing course look at some of these issues, like obesity, but also on how Kiwi innovations should change the future of health science. Recently, Auckland-based company Code Biotech won the Supreme New Zealand Innovator Award 2015 for their contribution to a new anti-cancer therapy. Bettina Artreiner spoke to CEO Stephen Henry on what their innovation is about and what he thinks about their success.
UK-based Agile Immune has found the missing part for their anti-cancer therapy in the technology of Kiwi company Code Biotech. The CEO of the award-winning Code Biotech, AUT Professor Stephen Henry, invented a synthetic glycolipid that is able to attach sugar molecules onto human cells. Agile Immune has developed such a sugar molecule that enables the body immune response system to destroy tumor cancer cells. Combined, these two technologies now have the potential to save numerous lives. Even Henry didn't think that Code's technology had such an impact on human medicine.
Our invention enables other people to do things that are really cool, and many of the things that our technology is doing are solving problems that people haven't been able to solve before.
Code's invention is applicable to almost every aspect of biology and medicine. Henry says that he can't see the limits of possibilities Code created for research all over the world. Agile Immune's anti-cancer therapy is scheduled to undergo human trials next year. Even if there is still a long way to go, Henry is certain that together they have created something remarkable.
On a national basis, Caitlin Fowles looks into the problem of short staffing issues at West Auckland hospitals and the risks involved. Amanda McLean, a nurse at the Waitemata District Health Board, talks about her experience and insight into what the WDHB is doing about the problem.
Short staffing issues at Waitemata hospitals are causing wards to avoid using bureau staff to cut back on extra costs. The issue in a lack of nurses to patient ratios are hospitals not utilising bureau staff to cover the shortage of nurses. Waitakere Hospital uses a software called Trend Care Systems to assess the patient's level of care. This system estimates a nurse to patient ratio of 5:1 depending on the patient's condition. However, hospitals are finding ways to avoid using bureau staff to cut back on costs.
So they move nurses around from other wards to cover other wards,
said Amanda McLean, nurse at WDHB. This is a serious risk to patients who need 24-hour care and supervision on the wards. The problem is not a shortage of registered nurses, it's the lack of funding hospitals receive to afford bureau nurses. To deal with this issue, the WDHB offer a 1-year new graduate program to support new nurses and help with staffing numbers. This national issue is concerning for the community who deserve proper health care.
Recent statistics show an increase in childhood obesity caused by unhealthy eating habits among the children in Auckland. There is a significant increase in obesity among those between ages 2 and 14. Figures highlight that 1 in 10 children are obese, out of which 15% are Maori and 25% are Pacific Islanders. These children are at risk for serious health conditions, including cholesterol, diabetes, sleep apnea, and heart disease. According to pediatrician Yasmin Mustafa, the main causes are junk food and sedentary lifestyles.
The cost of living is becoming more expensive, so families are opting for cheaper foods which tend to be less healthy.
As fast food has become a cheaper option, they are eating more processed food and less fresh fruits and vegetables. Recent surveys also show that they are now spending less time outdoors and more time sitting in front of TVs and computers. The government is planning on imposing a healthy food policy in schools and colleges in New Zealand. The Sports Ministry is also developing programs to promote physical activities and healthy lifestyles for children.
And finally, Annalise McNally talks to Unitec student Pale Faletoi on how he overcame his obesity and became a personal trainer. And Annie Santos talked to Shona Arms of Unitec's Health and Safety Department about their non-smoking policy to provide a healthy environment for students, staff and visitors.
Pali Falatoi went through a childhood of obesity and unconscious eating, but bullies made him suddenly turn his life around. The young man made some dramatic adjustments to his regime and routine. This helped turn him into a CrossFit coach and tournament competitor. From overeating and not taking care of his diet at all, Pali decided to cut carbs out of his diet and follow a strict training schedule. He chose to follow the paleo diet that avoids high carbohydrates, for example, no eating rice, bread, or potatoes. Pali has said that growing up overweight led him to have many childhood health problems, including asthma. He found the answers to a healthier life in CrossFit training and says that he would never want to give up on it. The strongest man New Zealand runner-up believes that staying focused is the key for success. Pali is on his way to become a civil engineer, and he encourages anyone who wants to change their lifestyle to do it.
It is never too late to change,
He commented, trying to inspire others.
Unitec's health and safety team continues to receive complaints about non-compliance to the university's 100% smoke-free policy. Complaints share that smoking and secondhand smoke creates an overall negative impact on their experience at Unitec. They abolished their previous policy where outdoor smoking was allowed, provided that smokers are not inside the 5-meter restriction zone. However, this made smokers complacent smoking on campus.
So at present we have no punishments, but we're looking at a redraft at the moment of a policy that would give security a few more powers around stopping people smoking.
Said Shona Arms, Unitec's Health and Wellbeing Improvement Advisor. The current policy is more in supporting anyone in the process of quitting rather than disciplining. The Health and Safety Department supports the policy by conducting quitting programs. The health center sells nicotine patches, gums, and lozenges at $5 used for nicotine replacement therapy. Staff are also encouraged to hand out a quit smoking card to anyone that is seen smoking on premise. Unitec is taking the initiative to help make New Zealand smoke-free by 2025.
Even though there are major issues amongst the health themes in New Zealand, it's also noticeable that there's a lot of development around addressing and solving these problems. This was the Carrington Road Report on Health Issues and Innovations around New Zealand 2015. The program was produced by students enrolled in the Department of Communication Studies at Unitec.